Better quality of care, better decision making, and it even allowed us to change what we're doing, which is in a regular patient who needs coronary artery bypass grafting, we don't have to be that invasive and put a swan in a patient to test the physiology because we've got a continuous cardiac output, SVR, systemic vascular resistance, cardiac index, and cardiac power, and aortic stiffness, and SpO2 waveforms. And so that kind of, for me, was the exciting thing because it was, well, I can't get this in the pre-op, so I can't tell you how underfilled they were. And so what it tells me is that from there to intra-op, I now know how much to fill them accurately. Once the physiology changes, once they're fixed, say we've done a valve, then we can go on to tailoring inotropic support or not. And what's really good is when you're in the ICU and, we use different monitors. Some of my colleagues, when they're on the weekend covering, they'll have patients who are on different systems. And they are a little bit baffled when they're talking to the patient. They look fantastic, but their numbers are reading lower. And so they've now adopted using this device too, because it says to them, well, what is the true delta in the change of that patient when they're sitting and talking to me, when another device is saying they're really, really sick and you need to start inotrope suppressors and everything else. So I think, one has to be using a better quality system for making sensible decisions for your patients and also pushing the envelope a little bit. We've now abandoned using arterial lines in transcatheter valve surgery because we save that line for putting in catheters in the radial artery. So, and it saves time, but it's also safer, and we have accurate readings. So once we are comfortable, and there's also elderly patients, mind you, that we are looking after, which have better, who have critical physiology that we have to be monitoring. So it's given us confidence and trustworthiness in making the right decision because we verified them by looking at our results on the swan gowns in the operating room, using an echo to actually say, look, this is what the heart really looks like. We're looking at the heart with an open chest. And now we've done about 50 patients. And I think that we are pretty comfortable with going into an arena where we can be safer and a lot more accurate, frankly.